All right, everybody, we're going to get started. Thanks for coming tonight. My name is Travis Robbins. I am the owner of Robbins Rehabilitation. Anybody heard of Robbins Rehabilitation here yet? Besides Judy? No? So we're a privately owned physical therapy company here in the Lehigh Valley. We have 5 locations, 2 in Allentown, 1 in Bethlehem, 1 in Easton, 1 in Phillipsburg. The one closest to you guys, we have 2 of them in Allentown that are pretty close. So I'm going to talk a lot about me, low back pain. First, I want to bring James up here. So James is the Robbins Rehab Executive Chef. Not many physical therapy clinics have their own executive chef. That's what makes us a little bit different. A lot of things that make us different. But this is James. He's going to talk a little bit about his food and a little bit about himself.
So, good evening, everybody. Introduce myself already. I met Travis back in 2006 because I hurt my back. And we've been good friends ever since. And the thing that he and I both really had in common, obviously, was we both like food. But there are 3 reasons why I'm really here tonight. Obviously, because Travis is here talking about low back pain. And one of the things that's important to us in Robbins Rehab as well is, community wellness and whatnot. And it's important. If anyone here continues to want to be active as you're getting older, and even myself saying this, it's important to, chip away at the stone and continue to do things so that you will be a little bit more active as you're getting older and whatnot too.
Age gracefully, right? Isn't that what they say?
That's right.
That's right.
And again, I've been in the industry since '98, and I've worked in a lot of different facets in the industry, from country clubs to hotels, conference centers, private caterers, and even restaurants. And right now, I'm actually in the food service side of it, working at a continuous care retirement community in Gladwin called Waverly Heights. And part of the reason, again, that I'm here with Travis and have a little sampling of food for you is one of the things that we're interested in doing for you all exclusively is to be able to work. And my hopes is that I would like to be able to build a relationship with you all on if there was any type of an event or a party you would like to do in the future, that I could work with you on that. And then you'll probably see us here again together doing other types of workshops as well. Okay, so I'll be around, and I'll be coming up and saying hello to people, and I'm sure people have questions about the food. Just real quick, and I'll mention, wow, I'm going to attack the asparagus, I see. Yeah, that had prosciutto in it. Everything else is pretty much vegetarian, and if anyone has any questions, please let me know. Okay?
All right, guys, so you signed up. I didn't see a lot of emails over there. So James is going to email you the recipes for tonight if you guys are interested, if you like this stuff. So if we have access to your email, we can send that to you. I'm not going to call you and then give you the recipe over the phone. So if you are interested in this stuff, leave us your email. We promise we will not spam you with any other recipes or any other bad stuff. So if you're interested in that, then just make sure we grab your email on the way out. Thanks, James. All right. So, oh, by the way, this is really interactive. We call it a workshop. Because I want some interaction from you guys. So if you have questions about stuff, if I'm going over stuff too quickly, if you want me to slow down, if you want me to go back and talk about something, then let me know. Also, if you want to go get more food, don't feel badly getting up in the middle of me talking, because I'm going to talk a lot for the next 45 minutes. So like I said, my name is Travis Robbins. I'm a physical therapist. I have a lot of different roles. I'm a father of 4. I'm a business owner. I'm a coach. I'm a husband. But in terms of physical therapy, I still treat patients. I still treat patients a lot. And as we expand that, it might change a little bit. But for right now, I'm still treating 40 hours a week. I love to treat patients. I've been doing it for over 15 years now. But one of my favorite roles is of an educator. So what I have to do inside of this, like 45 minutes to an hour, is I have to take all the education experience that I have, and I have to break it down and give it to you in a digestible amount. So all of the people that are here, anybody here have low back pain? Okay. Okay, so pretty much everybody raised their hand, right? So do you guys have any idea if you live to be, a general age, like I don't know what our life expectancy is now, somewhere around 80, what percentage of people will have low back pain at some point in their life? It's like 90. It's like 90. So if someone goes through life without any back pain, that's pretty incredible, and some kind of genetic abnormality that allows for that, right? So what I want to try to do for you guys is give you education information on how the spine works, what you can do to prevent back pain, and what you can do to help you out with back pain right now if you have it. So I've got to boil that down into like 45 minutes and get that to you as quickly as I can. Yeah?
I have a question.
Yep. Already, questions already.
I have
Uh-huh.
and a pinched nerve
Uh-huh.
on the lower back,
Mm-hmm.
which is I got to jump easily
Mhm.
over there. I went through there and physical therapist back in 1985. That's when I got hurt on a job, and the physical therapist they helped me a lot. And the only thing says, like during the warm weather, I'm fine. But like when it's a damp or humid, that's when I get a pain in my lower back.
Mhm.
And what happened is, I get the pain, the nerve is getting too tight. And that's when it started being painful, when the nerve is pulling.
Mm-hmm.
So what I do is, I put a hot water bottle on the lower back,
Mm-hmm.
which is to relieve my muscle. And they help me a lot.
Hey, so sound familiar? Back pain gets worse when it's like humid or barometric pressure changes, right? Put heat on it, feels better. Sound familiar? Okay, so we're going to talk about that, and we're going to talk about why that happens and other alternative things to do to work on that. So we're going to talk about that, the disc and the cushion. That's good. Man, you're like have come to my seminar before, must be. All right, so we're going to talk about all that stuff. But I just want to tell you guys that this is my favorite 45 minutes of the week. Like, I love doing this stuff. So if I'm excited up here, that's why. So if you guys have questions, just kind of spit them out to me. So all of you guys should have a packet. If you don't have a packet, go get one. We're going to follow along this worksheet here. So just to kind of keep us on track, there's dashes in their lines, so you guys can fill that out as we go. You don't have to fill it out if you don't want to, but I think to keep everybody on the same page, it'd be good to kind of fill out the lines as we go here. And then again, if you have questions, just kind of spit them out as we go. So how I came to specialize in low back pain. So physical therapy is a lot of low back pain. Why? Because most people at some point in their life have some kind of back pain. So we see, just by sheer volume, we see a ton of low back pain. Our clinic sees a ton of it because we kind of specialize in it. So there's different training that I've done and different things. Has anybody ever had physical therapy before? Okay, so physical therapy varies quite a bit. So we're going to talk a little bit about that too. But we see so much spine and see it so often that we kind of specialize in that. So how that happened was when I first got out of school. When you get out of school, you don't know what you don't know, right? So you think you know everything. So I thought I was great, and had a couple jobs before I opened up my own practice. I'm unemployable. I had probably 7 or 8 jobs before I opened up my own practice. And then when I first started treating patients, my success rate looked something like this. About 25% of the patients that I saw with low back pain, complete resolution, fixed everything. They wanted to adopt me. They thought I was awesome and had no problems, complete resolution, right? About 50% of the people that I saw did pretty well. They got better. Like, I improved the problem, but I didn't get them to where they wanted to be. And it's kind of disappointing to me, right? I'm a competitive guy. So I didn't like that. And about 25% of people, no matter what I did, I couldn't help them. Threw the kitchen sink at them, did whatever I could, and either made it worse or didn't make it any better, right? So that's not okay with me. So when we started kind of working on that a little bit more, part of that is education and part of it is experience, right? Anybody work and have experience and see the value of like just being on the job for a while, and as you see repetitions of stuff, you start to pick up different things that are right and wrong. So experience is part of that. So it's kind of young. I was 24 when I opened my own practice. So experience is part of that, but education is also a part of that. So on your sheet here, it says Super Dave from MTI. So when I was about 25, guy came into my office and he dropped off a resume, and my secretary took it and he just kind of left. Hey, who's that guy? He dropped off a 4-page resume, front and back, 10 font, no spacing. And you guys have to like look through resumes when you're working. The rule is like you're only supposed to have like 1 page, maybe a back of a page. This guy had so much education and was on faculty at so many different places that like he probably left stuff off of there. So we call him Super Dave just because of that. But he came in and we said, well, it's kind of expensive, but my brother and I said, you know, getting results like this, we got to get better at this. So at least if we hired him, he can help us out. So I still remember the first day back when we were small, there was 3 of us. It was me, my twin brother, who also owns a practice with me, and Kelly, which was our first physical therapist. And we had tables along the wall, and we were all treating at the same time. And you could see that Dave was doing way different stuff with patients than what we were doing. And so we're kind of looking down there and see what he's doing. And eventually our patients are looking down there and seeing what he's doing. And they're like, why aren't I getting what's going on down there? And it's because we didn't know what it was. So at the end of the day, we said, hey, what's all this stuff you're doing? He said, well, it's manual therapy. It's different things that I learned, different things that I teach through the schools that I work with. And it works really well. And his patients were getting better. And we said, well, you got to teach us that. So every Tuesday for about a year and a half, we met for 2 hours, and he kind of taught us everything that he knew. And then eventually he said, you know, I taught you kind of what you need to know, but you've got to go on and get the schooling. So I'm fellowship trained in manual therapy, which doesn't mean anything to anybody in this room, but it's about 2.5 years of school that I had to go to Chicago to do, and then another 2 years of mentorship under someone on faculty, where you learn more in-depth information about manual therapy, which we're going to talk about what that is. And it's just extra education that I didn't have that was leading me to results like this. Right? So now, that was a long time ago now, I've been out of the Manual Therapy Institute now for probably 6 or 7 years. Now results look more like this. So about 95% of the people that we see, complete resolution of back pain, and about 5% I can't fix. I still don't like this number, but it's true that I can't fix everybody. But the results are a lot better now than they were when we were back here. Right? And we'll talk about why that is as we're going along here. So what is sciatica? Has anybody ever heard that term? Okay. Does anybody want to tell me what it is? You've heard of it?
It's
Nerve pain. Yeah, so pressure on a nerve, and pain typically goes down your leg.
That's a pinch nerve.
Pinch nerve. I really dislike that term, pinch. If I were to pinch your nerve, we wouldn't be here right now. We'd be going to St. Luke's Hospital or wherever hospital we're going to. So pressure on a nerve. When I think of pinch, I think of I shut my finger in a door. So that's like severe pressure, like debilitating, screaming pain and weakness in your leg. If that happens, then you're not coming to physical therapy. You're going to the emergency room. Yeah.
The pain started from the lower back all the way down to my bottom of my foot.
Pressure on the nerve. Yeah, so you definitely have pressure on your nerve for sure.
That's the pain.
Yep.
But this is only when there's a cold weather.
Okay.
It's also, what I want to ask you, is when I sit on the hardwood bench or any kind of hard place or hard, I can't sit too long.
So it gets worse with sitting.
Because what happened is it put too much pressure on my back.
Okay. Might be.
And sometimes I get numb.
Okay.
It's stiff.
Yep.
Stop. And it needs to relax. As long as I move, I'm fine. If I was sitting there, especially on a hardwood bench or anything, that's when I start to get.
All right. Anybody else identify with that? Like I'm good when I'm moving, but when I stop moving, it gets worse? Yeah, we're going to talk about why that is too. Okay, so the sciatic nerve is the what nerve in the body, do you think? So the first line there. Longest or largest, right? So it goes down the back of your leg, starts in your lumbar spine, comes off the 5 segments in your lower lumbar spine, goes down the back of your leg. It's actually the thickness of your thumb. That's how big it is. And once it gets to its thickness in the back of the hand. Okay? So, and then it's actually 2 nerves. So when it gets to a couple inches above your knee, it splits off into 2 nerves. It splits off into peroneal, which goes down the outside of your leg, and it splits off into tibial, which goes down the inside of your leg. You don't have to remember all this stuff, but it just gives you the idea that anything that's going on in the lumbar spine, if there's pain in the lumbar spine, that can very easily send symptoms down your leg. And you don't always have to have pain in the back to have sciatica. Sometimes people don't have back pain and they just have sciatica, which sciatica is just a garbage pail term for pain that goes on the back of the leg. There's lots of things that cause sciatica, but that's the term for pain that goes down the back of the leg. So we talked about this. It travels from the low back, down the back of the leg, all the way into the foot. Okay? Sciatica sufferers may experience what numbness or what in the leg? What do you think? Tingling? Yep. So the other one is pain. Some people, when they have pressure on the sciatic nerve, right, when there's some kind of pressure on the nerve, it will cause pain, numbness, or tingling. And those are the most common symptoms that you have. Mm-hmm.
How close does it go to your, like, the hip? Where does it travel down?
So at right about here, that's when all the nerves kind of come together, and then it becomes one sciatic nerve. So right in the back of your hip. So people that complain of pain, like right in their butt, those people, and especially when you sit, like if you have pressure on it, okay, that will cause that numbness, tingling, pain.
Sometimes when there's a nerve, when in the cold weather, the pull of the nerve, and I feel like I can't sit like this. Stand in this kind of position, I can't really stay straight.
Okay.
Because it's full of the nerve.
Mm-hmm.
And it's too tight. And one time I put a high heat and lower back, it
Feels better.
The nerve
Mm-hmm.
and the muscle.
Yeah, some people respond really well to heat, so we'll talk about that too. All right, so the question here is the pain, numbness, or tingling, it's reproducible? Meaning, when you come into my clinic, if you can do something, some movement, position, activity, or you can tell me like something makes the pain worse, like you say it's worse when I sit on a hard chair, that gives me information. If it's reproducible, If so, then it's likely reducible. So this is what this means. This is like the most important question that we ask our patients when they come in. If you come into my office and you have screaming pain, like 6, 7, 8, 9 out of 10, doesn't change with position, movement, anything, constant pain, you're not a candidate for physical therapy. Like, you're going to the emergency room. Okay? So, which is not typical. I'll see 1 or 2 people that would come into all of our offices a year that have that kind of symptom, and then we call the emergency room and they go. Most of the time, you can think of an activity, position, or movement that changes it. Either makes it better or worse. If you can do that, then usually that responds, I mean, you're in this 95% of people. That responds pretty quickly to conservative therapy. All right, so I want you guys to fill this out. So just kind of circle what irritates your back pain. So I have pain with, so if your pain gets worse with standing, then circle that one. And these are the most common things that people will say as their reproducible sign. Like when we say, okay, what makes the pain worse? So standing, walking, those are usually together. People that typically have pain with standing will have pain with walking. Sitting, so right, you're going to circle that one down there. Lifting, like if you have to bend over to lift things up, if that's painful. Not necessarily heavy things. If you have to bend over to pick up a sock on the ground, include that too. Changing positions. So some people, especially with one of the main causes of low back pain, are going to say, yeah, I have pain when I transition positions at night, or when I go from sitting to standing, or if I have a low car, or I get into a low couch, or in a doctor's office if they have low chairs and I have to get up. Changing positions, moving from sitting to standing, then sometimes that can cause an increase in pain. Okay? Golf and tennis. Anybody play golf and tennis here? Yeah? Okay, so those are my rotational athletes. So any kind of rotation where you're kind of turning the spine, if that bothers you, then circle that in there. And then running, if any of you guys are runners, if that causes pain, then circle that there. Okay? All right. Anything else bother people? Like anything that's not on here that increases your back pain, or we pretty much cover it? That's pretty much it?
I get it. Sometimes if I sleep on a different mattress than I'm used to, I get it, like in the hip.
Okay.
And then it's like this whole area right here.
Okay.
I don't know if it affects that nerve or if it's just the hip.
So typically, if you say, man, I have pain just like in one spot, that's more like a joint dysfunction. If you say, I have pain across the whole area, that's usually nerve irritation. They rarely come separately. Usually there's some joint dysfunction with some nerve irritation and vice versa.
Yeah, it radiates kind of to the back.
Yep.
And then it's like,
Yeah. Yeah. If you have a large area of pain, then that's usually not just joint dysfunction. There's some kind of nerve component to it, some kind of muscular component to it. Right. So that's what's irritating it, for sure. Yeah. Yeah. Yeah, because that's like every time you have a bad mattress, it reproduces that, right? Right.
Mine seems to be first thing in the morning.
Okay. Anybody have like stiff and sore first thing in the morning?
It's hard to stand up straight.
Okay.
I gotta walk around a little while and
Loosens up.
it tends to loosen things
Yeah.
up.
How about end of the day?
Not usually, no.
Okay.
No. Just first thing in the morning.
Yeah. That's probably pretty common in this room, right? Stiff and sore in the morning, get moving around, feels better. Okay. So we'll talk about why that is shortly. Okay, so if you guys are comfortable doing this, we're going to make this a little interactive because I want to try to help you find out what is causing your low back pain. That's our goal for tonight. So everybody stand up that wants to, okay? And now we're going to do some motions, and I want you to remember or just kind of circle down as we figure it out, which motions make your pain worse, okay? So the first thing we're going to do, super simple, it's going to keep your legs straight, and you're just going to bend down towards your toes as far as you want to go. Don't push into a lot of pain. Okay? If that makes your back pain worse, then just kind of remember that. Okay? And then come back up. Okay? And now we're going to do the exact opposite. So you're going to put hands on your hips, and we're going to extend back as far as you want to go. Okay? Good. And then back. If that makes your back pain worse, then just remember that and circle that down. All right. Now you're going to put your hands on your side. You're going to slide your right hand down your side. Almost got you. See, I went this way. Right hand down your side, do the opposite of what I'm doing. Okay, and then come back up. And then same thing, left hand down your side. Anybody have more pain going left than right or one of those ways? Yeah? All right. Anybody want to volunteer and come up and I'll fix your back pain? All right, let's go. You guys missed out. She's going to get free medical care. Okay. All right, so you mind if we talk about your back pain a little bit?
Well, I did have the surgery, is the laminectomy on the, is that what that
Okay,
is?
how long? Well, there's lots of different
Well,
surgeries. You had a laminectomy?
Yeah.
Did you have a
about
fusion
8
or no?
years ago. No, I had fusion in my neck.
Okay.
And then I had because I had the sciatica that was just crazy.
Yeah,
and
wouldn't stop, constant pain.
I couldn't even walk.
Yep. So those are surgical
Yeah.
candidates, right? Like if
Yeah.
constant. Did
I-
you have a
I
drop
was-
foot? Like would your
No, but I had such numbness and weakness in my legs, and it was.
the whole leg
difficult.
was weak?
Everything.
Okay.
Yeah.
So you have laminectomy. Anybody know what laminectomy is?
Yeah.
So we'll draw it up here in a second. But you take the back chunk off of a vertebral body, and then that relieves pressure. Okay. So when you had that, what happened after the surgery?
Well, after a couple of days of extensive pain, then I was great.
Okay.
I was great.
Okay.
I haven't had any problems with sciatica since.
Okay. And now what kind of pain? You're just having low back
Low
pain?
back pain.
Okay.
Yeah.
All right. And what makes it worse?
Standing,
Okay.
and if I walk a lot, depends on the surface.
Okay.
But when I went to the left, it hurt.
Okay. And when you went to the right, what
It
happened?
wasn't bad. No,
Okay.
it wasn't bad. It's just I have vertebrae down there that are all mangled.
Okay.
So
Anybody else have gotten diagnostic testing and said, like X-rays or MRIs, and said like all mangled at the bottom?
that's me.
Yeah. It's pretty common, right? Anybody over the age of 30 is going to have some kind of finding on an MRI. You're never going to find a completely clean MRI. So that's common. That doesn't mean you're going to have back pain forever. It just means you have those findings, and it's information. But people typically kind of marry themselves to their diagnostic findings, like, oh, I've got degenerative disc disease, I've got a bulging disc or a ruptured disc. So I have 2 ruptured discs in my lumbar spine. I hurt playing football in college. I never had back pain, almost never, right? Because I know what to do to kind of fix that specific problem, which we're going to talk about. So what bothered you more, bending forward or bending back, or that didn't bother you at all?
No, that didn't bother me.
Okay, so the only thing that bothered you was what? Bending?
Going to the left.
Okay, and what happens when you do that? Is it pain on this left side?
Yeah, it's right in here.
Okay, come stand here for me for a second. And so now do that. So go to the left here. So just kind of there, and then pain like right there?
Yep.
Is it like a small area or like a watermelon?
It's right in there. It's
Okay.
a small area.
All right, and then come back up. Okay, and then do the same thing again. So slide your left hand down. All right, worse, better, same.
Oh, better.
Okay, all right. I just fixed her back pain. Did you guys see that? All right, does anybody know why that is? This is like extra credit. You guys get this, you can have like the last serving of pizza or whatever we got. Anybody know why that is? All I did is I put pressure in her lower lumbar spine. Oop, like no pain?
No pain.
No pain. I just got to walk around with her all day like this. It should be fine, right? I can do that. It's just very expensive. Right? Anybody know why that is?
Compression of your spine.
Yeah, so compressing the spine. Well, what happens when I compress the spine? What does that look like? Anybody see like someone wear a weight, like a
Those belts.
belts? Yeah. Okay. So what I did is I provided the stability for the spine that she doesn't have because she's not turning the proper muscles on, right? So I did that for her body. Hey, it feels great. Yep.
At work, they give me, when I got a hurt, an injury for the lower back, what they do, they give me a belt.
Did it work?
Oh, yeah.
Number like one of.
I hold it steady.
Yeah.
When I lift the image
And you
up,
felt pretty good.
I hold it steady.
Yep. One of the for acute low back pain, one of the most effective treatments for that is to put a back brace on. Okay? Ever see the guys at like Home Depot and Lowe's and the girls that wear those things? Okay, I'm not going to see that person when they bent over and picked up a pallet of something heavy. Never happens. You know when I see them? When they take that off at the end of the day and they go to untie their boot, like every single time. Okay, because why? This makes sense, right? So if I'm providing the stability for the body's an efficiency machine, right? It's trying to do as little as possible. So if you tell the body, hey, I'm going to do this job for you, the body's like, great, I'm not going to do that anymore. The muscles, they get smaller, they get weaker, and then you bend over to tie your shoe without your brace on, unless you want to wear that thing all day, every day, then it's not a good long-term strategy. And we're going to talk about strategies in terms of low back pain, but it's not a really good long-term strategy. So
So it's all part of the core then.
Yep, so anybody heard that term? We're not real big fans of that term, but that's what you guys know. But the inner unit is what we call it, the muscles that kind of stabilize and allow for proper movement. Right? So let's check a couple things here. So I think I already have a pretty good idea of what's going on, but I want to check a couple things with her joints. So are you okay laying down on your back on the table?
Which side?
Doesn't matter, whichever one's better for you.
Okay.
All right, good. All right, so from here, bend both your knees. Good. Push down with your feet and lift your hips up off the table. Good. And then back down. And then flatten back out here. So just kind of relax here. So one of the most important things in finding out what's causing low back pain, because it's very rarely just one thing. So we know she has a muscular problem, right? Muscles aren't activating, but usually there's some kind of joint dysfunction behind that. Okay, so there's joints, there's nerves, there's muscles. Those are the 3 main things that are going to cause problems in the back. So as she's laying here, her right leg is longer than her left leg. Have you ever tell you that? Mm-hmm. Okay. Who told you that?
My masseuse who did myofascia on me all the time.
Okay.
Always work on that.
Okay. All right. So very unlikely that her right leg is really longer than her left leg, meaning if we took an x-ray and measured the bones, that there's a real difference. That would be a true leg length discrepancy. Again, I see 1 or 2 of those a year. Right? What's probably happening is if this leg is long, if you put your hands on your hips, you're really putting your hands on your iliums, these big pelvic bones that are here. So if this one is long, it's usually that this ilium is rotated forward and would make this leg longer, or that one is rotated back that would make that leg shorter. Now, you don't walk around all day like feeling like you have one leg longer than the other. It's not a huge difference, right? We're not talking like an inch difference. It's like half a centimeter. But when your body's not in balance, then typically things go wrong above or below that chain. Okay? So is that like the number one thing that's causing all of her problems? Probably not, but it's a big thing. Okay? So if she's not working from a zero position, like a balanced spine, then you're going to have problems somewhere else. So is it okay if I fix that? Sure. Okay. So first we have to find out which side is causing the problem. So if this leg is long, there's a chance that this ilium is rotated forward, which would make this leg long, or that ilium is rotated back, which would make that leg short. Okay? I don't know which one it is until I find out how the joint is moving. So you have 2 sacroiliac joints. Everybody ever heard of those, sacroiliac joints? Okay? So your sacrum is what? Your tailbone, triangle-shaped bone wedged in the bottom of your spine. Okay? Your iliums are these 2 things on either side, right? So what happens is triangle shape shoves down in between these 2 bones, and then you have 2 joints. You have a right SI joint and a left SI joint. Usually, the SI joint that's stuck, that's not moving properly, is the one that's in dysfunction, usually. Right? And now you said you had pain on the left side, right? Mm-hmm. Not always the side of symptoms, but a lot of times it is. So if I were to guess right now, I would say it's probably that one that's rotated back. But I don't know until I find out which joint is moving less. Okay? So you okay laying on your stomach?
Yeah,
Okay, lay on your stomach.
on my stomach.
Yep.
Okay.
All right, so just kind of relax here. Good. And any pain when I push here?
A little bit, yeah.
Okay. And then that's compared to this side. Any pain when I push here?
Yeah.
Okay. Worse or about the same both sides?
About the same.
Okay. All right. So from here, you're going to feel me kind of pull here. Okay. Any pain when I do that?
No.
Okay. Good. And then just relax here. I'm going to do the same thing here. Yeah. I feel like it's this side. All right. Can you lay onto your right side for a second? Your other right side.
Oh.
Every time, so do not laugh. You come to my office, if I say lay on your stomach, 50% chance they're going to get it right. I don't know what that, like on your side, I don't know what that is. You all are very intelligent people, but for whatever reason, something that you just go where you want to go. All right, so just kind of relax here. So I think this thing is rotated back. All I'm going to do is I'm going to mobilize it to rotate it forward. We already know she has a muscular problem, so I don't know how much this is going to affect her pain. So what we look for a lot in physical therapy is an asterisk sign, which is just a fancy word for something that is causing a problem, pain with motion, usually a motion diagram like bending forward, back, side to side, that is causing pain. And if I do something, what happens to that? So I'm testing this out. I'm constantly practicing physical therapy, right? So I'm trying to find out what the problem is. And physical therapy is great. It's not like heart surgery, right? So if I do this and I screw up, I'm not going to kill her. I might irritate her a little bit. If I'm a heart surgeon, I screw up, not good. So what we do is we test stuff. So it's test, treatment, retest, right? So test, pain, side bending here. We already did some testing in terms of muscular testing. So I want to see what was stabilizing the spine. Wasn't doing such a hot job. Treatment, so this is the treatment part, right? So this is just, I'm just mobilizing this, and I'm not doing all that much. I'm just trying to see if I can get this joint to move better and balance things out, right? All right, any pain with that?
No.
Okay.
Yeah,
Good.
no, good.
Good. All right, so lay back over onto your back now, please. All right, good. Now bend both your knees. Good. Push down your feet, lift your hips up off the table. Good. And then back down, and then relax. Good. All right, so I don't know if you guys believe me or not, but this is balanced. Now, if we call this the car test. So if I told her to walk out, touch her car, and come back, it would probably fall back out of position. Because why? Because she doesn't have the muscular strength to stabilize that. So has anybody ever gone to see a chiropractor for their back pain?
I went to the chiropractor.
Okay.
I didn't like it.
Didn't like it. Some people don't like it. So they use grade 5 mobilization, manipulation.
Instead of make it better, make it worse.
Sometimes that happens. Sometimes I make people worse, right? So there's good and bad chiropractors, good and bad physical therapists. This isn't about chiropractic and physical therapy. I regularly send my patients to my chiropractor that I work with. But where chiropractic typically falls a little bit short for me is they'll do the mobilization. They'll do that, maybe in a different way. There's a million ways to kind of fix that. But then they don't do the corrective exercise after. So what happens? You have to kind of rely on that chiropractor to keep kind of putting you back into place. So for this should take like 2 or 3 times. Like on her 3rd visit that she comes in, that should be cleaned up because now I've kind of taught her how to maintain that pelvic position, and then she doesn't need to have that mobilization anymore. All right, so let's go ahead and stand up. Let's see if I made it any better. Okay. So from here, just kind of slide left hand down your side. Worse, better, same.
Better.
Better, like 50% better, 80% better.
Well, it's detectable.
Okay,
you know.
still there.
I don't know the percentage, but
Yeah.
it's still there, but it's not. Before I kind of cringed, I went down.
Yep. So part of that is a joint dysfunction, right? So I address the joint dysfunction. Part of it is definitely muscular because when I test that and she goes that way, oh, yeah, pain completely goes away. So it's part of a couple things. So now let's take a look at the nerve mobility. And this is we'll kind of wrap up physical therapy. So lay back down on your back if you're okay with that. So we talked about, someone said, I have a tight nerve. Right? There's no such thing as a tight nerve. Anybody have tight hamstrings where they go to bend forward and like it feels tight back there? So I can give you soft tissue mobilizations. I can give you stretches to actually change the length of that tissue and give you longer hamstrings to some extent. A nerve, I wouldn't want to stretch out a nerve. If I stretch out a nerve, I would damage it. Nerve has mobility, so it moves back and forth in the path that it travels. So you can't stretch it out, but as you bend forward, for sure, your nervous system has to kind of glide back and forth. And if you have old injuries, repetitive motion type work, anything that you do repetitively, if inflammation and it builds up around the nerve and it causes scar tissue and that can cause a decrease in mobility, it just doesn't move very well. It doesn't mean there's damage, it just means it doesn't move very well. So now we're going to do some nerve testing here. So just relax your leg. I'm going to lift it up. You let me know when you feel a stretch but not pain.
Okay, we're going into a stretch.
Okay, where do you feel that? Back of the leg there. Okay, and then if I do this, then what happens?
It's right in here.
In your calf. Okay, but you don't feel an increase in the back of your hamstring.
No.
Okay, all right. So from here, now I want you to kind of lift your head up off the table. And when you do that, does that increase any symptoms?
No, not really.
No, okay, perfect. All right, come back down. All right, so go ahead and stand up. So negative nerve tension findings. So with some people in this room, if we got them up on the table, I lifted your leg up and I pulled on your foot, you would say, yeah, I feel that in the back of my hamstring. There's no muscle that I can change the length of by moving your foot that attaches up here. The only thing I can have an effect on is the mobility of the nerve. So if the nerve glides back and forth, if it's not moving properly, it can cause pain, numbness, tingling, burning as I do that test. So from here, inside of like, I don't know, 8 minutes, it felt like 8 minutes, probably more like 15, we pretty much found out what's going on, right? So she has a joint dysfunction. She has an inability to kind of stabilize the muscle, turn the muscles on that stabilize the joints in the lumbar spine and the pelvis. This is pretty easy to fix. I'll see 6 more of you tomorrow, right? That's a majority of what we say. But if you don't know that, then a lot of times you can kind of chase symptoms and not kind of figure out what's really going on. So what we do is we don't treat the symptoms. So if you go to your doctor for low back pain, what do you think is going to happen? Anybody been to their doctor for low back pain? Yeah? So anybody willing to share what happened? Yeah, especially if you know it's an MRI machine. So anti-inflammatories, shots, okay, and pain reliever, right? So that's not anti-inflammatories, and certainly a pain reliever is not going to treat sacral iliac dysfunction or like a decrease in muscle activation. Can we agree on that? You're just treating the symptoms. Right? So not sending you to someone to kind of treat the real cause of the problem, which is what we went over up here, then that's what typically happens. People will typically go through that cycle over and over again. So that's part of what, why I do this is because that's easy to fix, man. Like we do that every day, all day. Right? But if you don't know that it's that easy to fix and you don't know the right path to take, then sometimes it gets confusing. All right, let's have a hand.
Thank you. Thank you.
All right. Yep.
I cannot drive. I can't drive it for 2 hours straight.
So sitting makes it worse?
Because what happened is too much stress on my back, too much pressure. I have to pull out of the side of the road and walk.
Stand up, walk around, pain goes away?
A little bit and go back in the car.
Okay.
In other words, I can't take anything a long trip. I can take it, but
Got to stop, get out.
after 1 hour, my lower back just stops. And then you don't, because being sick too much on long position, too much pressure. So I have to walk around.
Yep.
Is there any way you could be able to give me any good idea for me to prevent it?
Yep.
Kind of problem?
So this is where it's really hard to give just general advice. I can do that. I just won't guarantee the success on it. So I've got to find out what's causing that problem, and it's hard to do just by describing that one thing. So we'll talk about how that process is handled at the end for sure. All right, so the number one single biggest mistake that sciatica and low back sufferers make is what? Yeah, right, you ignore it. You hope it's going to go away like all your other problems, right? Super common problem. Everybody know the average length of time, this is starting to change, average length of time someone comes in, I get them on my table, I say, when did your low back pain start? What do you think it is? That's common. So average is about a year to 9 months, okay? So now I get some people that come in the day after because they've been patients of mine before and they know how this works, but a lot of people, haven't done anything about it because they're just kind of hoping that it goes away. Rare that it goes away, but yeah, more often than not, it doesn't go away. So let's talk about what your options are if you have low back pain. So the first one is you ignore it. We talked about that. So you guys want the fire alarm analogy or the leaky roof analogy? You guys don't have leaky roofs here, right? These things are brand new. No? Fire alarm, all right. So I'm hoping that there are fire alarms in here, lots of exit signs, so I'm thinking. All right, so I light that on fire, and it sets off the fire alarm. What are our options? Don't overthink it. Run? Good. Wait, we get in our car? We drive away? I live right around the corner. I live less than 2 miles in here. I go away. We could call 911. If I just drive away, I ignored it. I went home. I'm fine, right? Problem is, well, not a big a problem for me. A problem for you, you come back here tomorrow, this place isn't going to be here. It's kind of nice, right? You want this place to be here? Right? So we ignored it. We said, maybe it'll just go away. And then it burns down the whole place. Okay? Kind of dramatic, but that's kind of what happens. Right? You just ignore it. Okay? So if you address it, what are other things we can do? We call 911. What happens? Yeah, your fire right up here, right? You guys see these guys? 2 seconds to be down here. We might have to redo the upholstery and get a new chair. It wouldn't even be that bad, right? So if we address the problem immediately, not as big a problem. If we have to rebuild this whole place, big problem, right? So that's what happens when you ignore it. You could alter it. So we talked about this a little bit, right? So number 2 is alter it. Pain medication and back brace. Those are the 2 most common things that you'll do. Effective in treating the symptom, right? One of the most effective things you can do to treat acute low back pain is put a brace on it because you're not turning on the muscles properly. But you've only altered it, right? Because once you take the brace off, what happens? Pain's there. Once you take away the pain medication, what happens? Pain's there. You haven't treated what's really causing the problem. Right? The third thing you can do is you can address it or you can change it. So attack the cause, right? Attack the joint dysfunction, attack the nerve mobility, attack the muscular activation that's not happening. Fix the problem that's causing the low back pain. All right, so now we're going to talk about the 3 most common causes of low back pain. So I bet you guys are going to do pretty good on this. So number 1 is herniated what? Anybody know what a disc is? Yeah. All right, so let's do, I'm not the best artist, but all right, I'm going to draw something. You guys are going to tell me what I'm drawing. This is you guys can shout it out whenever you want. What am I drawing? Anybody know? Spine, yes! These are vertebrae, segments of the spine. Okay? We're talking about your lumbar spine. There's 5 major vertebrae in the lumbar spine. Okay? What is in between here? Yeah. All right, let's go back to what I heard in the beginning. What is the main job of the disc? Thank you. Okay, everybody says that, right? And to some extent, it is a cushion, right? It's a barrier in between this segment and this segment, but its main job is it's a ligament. Let me know what a ligament is? So a ligament attaches bone to bone. Okay? So it's not a muscle. A muscle contracts and relaxes. It changes joint position. A ligament attaches bone to bone. So probably the easiest analogy is, anybody ever sprain their ankle? Okay, or know someone that sprained their ankle? There's 3 ligaments on the outside of the ankle here that hold that thing together. Okay? If you sprain your ankle, what happens? You typically, you keep doing it over and over again. So people will say, yeah, a couple times a year I get on my lawn and I'm mowing my lawn and I step on a rock and I sprain my ankle. It's because the ligaments aren't doing as good a job of holding together the joints on the outside, and every once in a while you go and you turn it over. Right? So once those ligaments are stretched out, they don't do as good a job of maintaining joint stability. So the biggest thing that this does, it does cushion, right? But the biggest thing this does, and we're going to do L4 and L5 because 95% of problems, either herniated disc or lumbar spines, occur at this level. Right? And we'll talk about why that is. But for right now, this disc attaches this segment to this segment. So when you have some kind of defect in that, when you have some kind of bulge, rupture, herniation, okay, what happens is the 2 segments that sit on top of one another, they have to move some, right? If they didn't move at all, that would be bad. That's a fusion, right? They can't move too much. If they move too much, then what does that cause? That causes inflammation, irritation, causes what's going on here, right? I don't move properly because now when I go to the side, this thing goes like this because that disc isn't there anymore. Okay? So its main job is that it holds those two segments together. Okay? And this is typically pain with bending. Which way do you think? So I'll give you two options, right? Disc problem, worse when you bend forward or when you bend backwards? What do you think? Forward. Yeah. Why is that? So let's talk about mechanics here. So this is the front of the spine. This is the back of the spine, right? So when I bend forward, if I have some kind of disc problem and I bend forward, what happens here? Squishes, right? And the disc is, I don't love this analogy, but we'll talk about like a jelly donut, right? So there's jelly in there. And what happens if you put pressure on the front side of a jelly donut? Then what happens? Goes out the back side, right? So you have this here. What's the problem with that? What's right behind the disc? Anybody know? Yeah, spinal cord. Okay. So off of your spinal cord come your spinal nerve roots, and those go down and make your sciatic nerve here. Okay. And it's right next to it. So if you have any kind of defect there, inflammation, disc, herniation, bulge, and it puts pressure on the nerve roots that come off of there, then that causes pain, sometimes numbness, tingling, burning that goes down the back of the leg. Okay? So when you bend, this is typically going to be someone that has more pain when they sit, because when I sit, what happens? I'm essentially, and you sit in poor posture, most people kind of sit like this. And we say we kind of hang on your ligaments, right? So you put pressure on the front of the jelly donut, you're pushing the material towards the back, makes the pain worse. I go to stand up and I kind of move around. Your body is way smarter than you think. Like your body just figures it out, right? What do? You get up and do this. And then what happens? It kind of, to some extent, we can argue on if it goes back in there or not, but it will take pressure off of that and at least push it off to the side. And then say, oh, I feel better. And then when I sit down, it gets worse. Or when I bend over, it gets worse. Right? So that's pretty straightforward. Someone that comes in with a disc problem, they're going to say all those things. It's pretty easy to pull out. Okay? So usually age what or younger, do you think? Usually. Usually age 50 or younger. So as you age, what happens is you start to lose water content in this disc. Okay? Anybody get a little bit shorter now than they were when they were like 20? Yeah. I used to be like 6'4", but now I'm just like this, right? So why does that happen? So part of it happens because you lose some of the water content. These discs get smaller, right? And then it doesn't seem like it, but this thing's tiny, right? But if you add all of them up, then it gets a little bit smaller. Some of it has to do with some vertebral body, like that will shrink too. But to some extent, this gets smaller. And then it's harder to herniate that disc. So the good news is when you get older, you tend to herniate disc less. So got that going for you, right? I got that going for me. Okay? So usually age 50 or younger. Doesn't mean it's impossible. Well, I'll see people that have disc problems. Like I love to say this. Right now I have this 78-year-old lady. She has a disc problem. And I say, you have the youngest spine I've seen all day. Right? Because typically discs don't herniate when you get that old. You lose the water content. But she has a really young spine. Okay? All right. Next, stenosis. DDD, anybody know what that stands for? Maybe if you had an MRI, you would have seen it. Degenerative disc disease, right? Or what's the most general term for this problem, do you think? What's the blank? Yeah, just arthritis. Yeah, arthritis. All right, this is pain with what or what, do you think? Okay, so this is standing or walking. Anybody go to the grocery store and can go for a little while or go walk around this nice place you have to walk around in, and then there's benches every little ways, and you have pain, you get to the bench, and then you sit down, the pain goes away? Is that anybody here? Walk for a while, have pain when you walk, and then sit down, pain gets better? Right? So if you have that, if you're over the age of 55, 60, 65, you have pain when you walk, it goes away when you sit down, 98% chance you have some stenosis going on. Right? And stenosis is part of a natural aging process, right? You're going to have a really hard time avoiding that. It doesn't mean you're going to have back pain forever. It just means that you have stenosis, which is just a narrowing of the space where this spinal nerve root comes out. So there's a hole here that is created when two segments sit on top of one another. It's called your vertebral foramen, but it's just basically a hole where this nerve comes out. As this shrinks and as that hole gets smaller, you just have less room for error. So you have to be really good at having normal nerve mobility to make sure that glides back and forth without any kind of inflammatory response that's going on in there, any scar tissue, old injuries that cause that. So again, just because you have stenosis doesn't mean you're going to have back pain. Stenosis is a term for how much space is between here and here, essentially. Okay? Doesn't mean you're going to have back pain. Okay? And we talked about this, usually relieved with sitting. Okay? And the third one is SI joint. Anybody remember what that stood for? I said it earlier. Sacroiliac. Good job paying attention. All right, so sacroiliac joint. So sacrum is tailbone. Ilium is this big hip bone here. Right, you have two SI joints. So sacroiliac joint problem. Usually ages what to what, do you think? This is a trick question. So it's 9 to 90. I've seen kids as young as 9 have this problem, and I've seen people as old as 90 have this problem. Typically in the younger population. Typically female population, they have a better genetic makeup than men. I don't know if you guys knew that or not. They have different chemical makeup, right? So they have kids. Anybody have kids in this room? Right? So as you go through that process, chemicals change, allows for opening of these ilium up. So what happens is that you typically see that more in females than in males. But with my males, I see it with my rotational athletes. So my golfers, tennis guys. So those guys are playing tennis and golf. Rotation, that's what I'm using. Or someone, every once in a while I'll get someone that has like a lawnmower where they got to kind of rip like that. And so that's kind of like rotation. That'll cause an SI dysfunction. So some of it, typically someone that comes with SI dysfunction, they'll say, man, I got pain right here. Like very specific to that spot. Sometimes they'll say the pain goes down their leg, but if they have pain right there, then that's usually an SI joint problem. Very easily corrected usually. Okay, very low need for surgery in terms of that. We just have to kind of turn on the muscles that stabilize that once we position the pelvis correctly. So got the pelvis in correct position. If we got up here again at the end of the night and I rechecked, it probably would fall back out. But because we haven't kind of educated on how to maintain that position. All right. So this is usually worse with sitting or position change. Okay? So you're saying pain worse with sitting. Could be a disc problem, right? We talked about that. If you're bent forward sitting.
Right now I'm not feel comfortable.
Okay.
See, when I sit in a position, when like this, I have to stay straight, my back.
And you feel better?
Because if I do that, yeah.
If you sit in good posture, you feel better.
Like this, what happened is no good.
I agree. Yeah.
Still have to stretch. I have to stand up. I can't sit too long. That's why you see me a lot.
Yep.
Because I can't stay still.
Right. So with our sitting people, that's usually SI dysfunction and disc, or a combination of those two things. Or change of position. So we talked about that, moving from sitting to standing, rotating in bed, side to side, something like that. Those are symptoms that people with SI joint problems are going to say. Okay. All right, so what does successful treatment look like? So we've talked about treatment, right? We've talked about anti-inflammatories, medications, what happens when you go to your doctor. We've talked about treatment with low back braces. We've talked about ignoring it. That's one form of treatment. But now we're going to talk about kind of what physical therapy does. So number one here is manual physical therapy to mobilize the spine and or sacroiliac joints. Okay. So you guys said anybody gone to physical therapy for their back? Yeah? Okay. You want to tell us a little bit about physical therapy? Like just you came in, like what happened? What'd you do?
It was quite a while ago, but like probably about 7 or 8 years ago.
That's not that long ago. All right, go ahead.
But, and I'll be honest, I can't remember exactly what the diagnosis was. But in the physical therapy, a lot of it was stretching and moving your legs. And I still have those exercises at home, and sometimes my back starts to bother me, I'll do them.
And it helps it out a little bit?
Yeah.
Okay.
And I remember like pulling your legs
Up to your chest?
and then
Side to side?
side to
Yeah.
side,
Pretty basic range of motion exercises.
pulling the legs.
Yeah. So
Okay. When I got hurt back in '86, I went to the therapist. What they do first, they give me X-rays on the lower back to find out where's the damage. So the X-rays I get a lot of X-rays. Then I went to the MRI. So the MRI, it told me exactly where the pain. So the therapist, they send me to put like in a bench there, lay down on my stomach. Where they do it, with the cream, first they put a hot water towel on the back, lower back, to release my muscle. After that, then they have the jelly cream and the lower back and keep rub. But they know exactly where to touch because through the X-ray and MRI, they know exactly where to touch through the MRI. And they massage and release, they do that and release my nerve and I feel 100% better.
Feel great.
And after that, then I went to the swimming pool. They make me which is making me walk inside. And they even better that too, they help me.
Okay. Now your back pain's completely gone, right?
Oh, but I'm still. The doctor wants to give me the surgery. I says, no way. I have my aunt. She went to the surgery, the lower back. She walks the rest of her life like this. The rest of her life. Messed up
Like
her
that.
whole family.
All right, great opportunity, right? So anybody had diagnostic testing on their back? Okay. So he's saying we did X-ray, MRI, they found problems in the spine, and it said so they knew exactly what to do. Right? Here's the problem with that. You don't know if those findings are causing your problem. Right? So I have 2 herniated discs in my back. Like I shouldn't be able to walk or move around, right? So if you took an X-ray, if you took an X-ray in my back, L4 and L5 really close together. If you took an MRI, you'd find herniated discs. I don't have any back pain. Right? But if you looked at my MRI, you'd say, oh, here, this is what we need to do. Right? So don't get married to your MRI findings. Right? So I really prefer people don't, unless someone comes in with what I was talking about, like screaming pain, unrelenting, doesn't go away, 9 out of 10, and I've had it for 3 days. Like, no, you're not a candidate for physical therapy. You got to go see an ortho. Right? But if you're walking into my clinic and you can reproduce the pain and we can find out what's going on, then I don't really care all that much about your MRI findings because you could have very nasty stuff in there and have no back pain. Right? Another thing we talked about is surgery, right? So surgery, a lot of people associate surgery with fix, and you'll find tons of people that have a really positive benefit from surgery, right? So great example, laminectomy, screaming pain, takes it out, feels great, right? And then sometimes you'll have people that have surgery and don't have the best results, right? So always try to handle things conservatively. Once you do surgery, like there's no going back from that. Like you can't undo that unless you want to do more surgeries. You guys know who Tiger Woods is? Right? 5 surgeries he's up to now. And they keep going back in there and trying to fix stuff. It's just getting worse and worse and worse. You guys know who Steve Kerr is? So he's the coach for Golden State. I can't believe I forgot that. I didn't have enough coffee today. So he just recently, last night or 2 nights ago, he was actually able to coach. He had very simple spinal surgery. Okay? It was just he was going to get a discectomy, which is kind of laser treatment. You go in there, and it's not. I don't think it was any fault of the surgeon. I don't think the surgeon was negligible. He just had an adverse reaction to it. He has constant pain. He's not laying bricks for a living. He's got to sit on the sideline and coach basketball. He can't even do it because he has so much pain because of the problems that he had from surgery. Right? So surgery is not always a fix. It is like an amazing thing sometimes, but you want to try to handle things conservatively. Yeah? All right. So getting back to like physical therapy, what physical therapy looked like. If no one did some kind of like mobilization or like hands-on treatment, okay, and sometimes massage can be hands-on treatment. You're not going to see a lot of massage in my clinic. I'm not a massage therapist. If you need massage therapy, I send you out for that. What I'm good at is mobilization, putting things back where they're supposed to be, and then teaching you how to maintain that. Right? So that part of therapy, it's an important part, but it's only like 3 or 5 minutes. Like when you come to one of my clinics, you're going to get manual therapy and to kind of align things to get things back to where they're supposed to be. But the other 55 minutes is going to be spent on educating you on how to turn on the muscles to maintain that, so you don't have to rely on me to keep doing that. Right? My goal isn't to have you come to me 3 times a week for the next 4 years. Like if I see that more than I would like, and then you're relying on somebody else to kind of provide you your back health, whereas I should just kind of educate you on what you need to do, and then you take that information and go with it. Right? So exercises to stabilize the pelvis. So what we didn't go over a lot of is we had like a muscular activation issue. That takes a long time. Like if I'm going to treat that, I'm going to need like the next 50 minutes to kind of figure that stuff out. But really simple exercises, kind of goofy exercises if you come into my clinic and you see us do it. Anybody has a weak core, what kind of exercises would you do to strengthen that up? Don't overthink it. Yep, sit-ups, some yoga, walking, like planks, leg lifts, like stuff you see in like the Jane Fonda videos, right? Okay, so that's typically not, it's usually going to irritate the problem, or it's going to make the problem worse, or do something. You can get stronger doing that stuff, but you're just putting strength on top of dysfunction. The exercises you have to do are for 4 main muscle groups, which are your transverse abdominis muscle that wraps from your back all the way around to the front, kind of like the barrel to your core. Top is your diaphragm. I mean, what your diaphragm does, kind of contracts and relaxes, allows you to breathe. So breathing is really important in spinal stability. And your multifidi muscles, which are these small muscles in your back, they kind of attach from segment to segment to kind of stabilize stuff. And then your pelvic floor, so the things that hold your organs up. And those are the 4 main muscles that we work on first, the fundamentals of lumbar stability, and then we can kind of graduate and do the heavier stuff. But a lot of people will just go and do a bunch of sit-ups. I heard somewhere on the internet that I'm supposed to strengthen my core. Sit-ups is like the best way to do it. Shortening the abdominal muscles just kind of bends you over further. Like, so if you have really strong abdominal muscles, what happens? You just go whoosh, like this, and then you're flexed in your lumbar spine. And if you have a disc problem, like you want to make it worse, do some sit-ups. That'll definitely make it worse. Okay, so you've got to kind of know the right exercises to do. Okay, and then the last thing here is traction with an unweighted treadmill. So in some of our offices, especially with stenosis, traction is effective. Anybody ever have traction, like go to physical therapy or know what traction is? So it's essentially like a table like this, and you put a belt around your waist and a belt around your chest, and we just kind of, there's a machine that kind of slowly distracts you. It's like a medieval torture device. Right? So it separates the space, right? So it makes this space bigger, can have some temporary relief, but typically not long lasting. And it's not very functional, right? If I lay on my back and I do something, like that's not going to make me a ton better because I'm not going to spend a lot of time on my back anyway. I got to spend time up, standing, walking, right? So what we do is we have treadmills that you kind of strap into, and then I decompress your spine while you're walking. So that's more functional, right? So I can take as much as 200 pounds off your body weight and then have you walk in a position where I can get the muscles to activate and actually have some carryover, right? So that's what traction is. All right. Anybody have any questions about anything? Yeah.
So if you have numbness anywhere, do you go to a physical therapist or a doctor?
So, does anybody know what direct access is? So direct access is you don't need a prescription from your doctor to go to physical therapy. Okay? So what it looks like is we're trying to divert patients from the doctor to come to physical therapy, but what we found is it's extremely less expensive on the medical system. Anybody, I mean, you got, I don't know what healthcare plans you have. I'm an employer, I've got to pay for healthcare. Every year, the cost for that goes up 20%. Like it's compounding interest, right? I have a tiny company, I spent 200 grand on health insurance last year. Next year it'll be 220. Year after that it'll be 250. It just keeps going up and up and up, right? So why is that? Usually because we're getting unnecessary medical care. So if you have pain, numbness, tingling, but you can change it, and it's not constant, then what should happen, what typically happens when you go to the doctor, so we talked about it a little bit, the doctors, general practitioners, I have tons of friends that are general practitioners, man, that is a hard job, that is tough, I would never want to do that. They're not orthopedic specialists, and the good ones know that, right? All I do is watch people move and tell them that they're doing something wrong, fix a couple things, and then teach them how to move properly. That's all I do. I don't treat the flu, I don't treat foot warts, I specialize in that. That's the first place that someone should go. Right? You'll have a lot of people disagree with me, but if you have numbness, tingling, burning, pain, you could walk into my office and you could do things to change it. You're appropriate for physical therapy. And what happens? The cost of physical therapy is minimal compared to other problems. Spinal surgery, you know what a spinal fusion costs? Anybody hear of like someone having a spinal fusion? Your family member might have a spinal fusion. Somewhere between $120,000 and $180,000. Like a course of physical therapy, $1,200. Right? Injections, anybody have injections for their spine? Right? Typically cost more for that one appointment than an entire course of physical therapy. And again, you haven't addressed the problem. You just kind of, you treated the symptom, which can be important, right? So it's not like I tell patients to never get injections because that can relieve inflammation and can make physical therapy more effective. But in that scenario, I'm doing things that are actually fixing the problem that's causing the inflammation. Right? So if you have pain, numbness, tingling, and you walked in here and you could walk out, you know, you're super appropriate for physical therapy. Yeah.
So,
Yep.
so you're saying you could, for example, make an appointment with you as opposed to...
Right, so sorry, I didn't even explain that. Direct access means in Pennsylvania and New Jersey and pretty much every state in the United States, you can come to your physical therapist without a prescription from your doctor. And the goal of that is to not go to your doctor and run up a $5,000 bill on pain meds, an MRI, and an x-ray. Right? And a lot of insurance companies now are not letting you get that stuff until you fail conservative care. Because,
I'm sorry to
Yep.
interrupt you. You accepted the healthcare empire.
we accept most major insurances. There's 5,000 of them.
My primary insurance is a Medicare.
Yeah, and your supplement is,
And the secondary, it's a healthcare.
Yep.
Well, you accept the healthcare empire.
Yep, so what we do is we run your insurance and we verify it. And just say,
That's good.
yeah,
That's my
I can't remember last time we didn't take a secondary insurance. They're usually pretty good with providers. Yes?
Medicare covers direct access?
Right, yeah, so Medicare, typically, I mean, for everything, Medicare is 80-20, right? So 80% is paid for by Medicare, 20% you gotta cover. Either you cover it out of pocket or you have a supplemental insurance, which most people have, which is a really good idea. And with that, you typically don't pay anything for physical therapy. It's a really good deal. But we verify your insurance. You might have a copay associated with that. You might have some co-insurance, but we would tell that.
It's everywhere you go. It's
Yep.
full payment.
Yep, but yeah, to answer your question, Medicare is covered by direct access. You don't need to go to your physician. I never discourage people from going to their physician. I don't want them to not go to their physician. It just doesn't change what I do, right? So if you go get an MRI and an x-ray and you do some anti-inflammatories, pain medication, it's not gonna change what I do. I've gotta watch you move, I've gotta check out your alignment, I've gotta see what's causing the problem and address that. I would never discourage you from going to your doctor. Okay? It's just not something that I need to have happen. And how physical therapy works now, you guys probably don't know this, but back when I graduated, the master's degree was like the big deal. You could still sit for your exam if you had your bachelor's degree. But now, every physical therapist in my office, except myself and my brother, who are the oldest clinicians, are all doctors. So they have a doctorate of physical therapy. And again, the point of that is we've really got to start cutting down the cost of treating low back pain, like multi-billion-dollar problem in this country, because it costs 10 times what it costs to go to physical therapy to get an MRI, which I don't really care that much about anyway, because there's things on an MRI that might not be causing your problem. Right? Again, I've got a terrible looking MRI. I have no back pain. Right? It's because the things that are on my MRI are not causing me any problems. Now, those things on an MRI can cause problems for sure, but that's more for someone that comes in, is like dragging their leg, can't move it, unbearable pain, constant all the time. Like that patient's not appropriate for physical therapy. But I don't need an MRI to figure that out.
Does direct access limit the number of visits to physical therapists?
No, only your insurance company will limit that. So Medicare doesn't have a set cap. They have different dollar amounts. We just have to fight with them to get more visits. But typical course of physical therapy is around like 10 to 12 visits. So that doesn't even come close to Medicare's first cap. Good question.
How lucky I have your card when you're done.
You have more of my information than you even know in front of you right now, right? So you cannot get away from me. So in your packets there is a ton of information from you guys. So
Okay, I'm sorry.
no, that's fine. Yeah, please remind me. That's fine. So let's kind of wrap up, and then you guys can ask me questions after if you want. You saw this email. You came here, right? So you had low back pain, some kind of interest in it. You listened to me talk for an hour about low back pain. Okay, so we've pretty much decided that a lot of people in here raised their hand, right, that had low back pain. Okay, so what are you going to do? You can stand up and you can get out and you can ignore it, right? You can continue to do that, or you can address it. Okay? So what I do, we don't do this to the general public, but from when we go do talks, what we do is a free screen. So it's a 30-minute one-on-one appointment with a physical therapist. Okay? You come into our office. We don't take your insurance information. We don't take any of your information besides your phone number, so we can verify the appointment. And then you get an appointment with a physical therapist. So one-on-one, kind of what I did here, but in much more detail. We kind of tell you what's going on. We tell you the cause of your back pain. We tell you what you can do in terms of physical therapy or other options. Like some people come in for a free screen and they're not appropriate for physical therapy. But most people are, because they've kind of gone through the process of they had back pain, they came to hear me talk, and now they want to start taking some action to alter that, right? So you want to take some action to make some kind of change in that. You're ready and you're sick and tired of back pain. And it's really usually pretty easy to fix, right? So 95% of people get complete resolution of back pain with conservative care. So if you guys are interested in that, this is our busy season, but we have our 2 offices up here. We actually have a bunch of appointments tomorrow in our Allentown office. We have 2 Allentown offices. One is up. You guys know this area very well. You guys are kind of transplants, right? So it's less than like 3 miles from here. I have an office in Allentown, and I have one in Upper Macungie. Our Allentown office has appointments this week. I know Upper Macungie has appointments. We typically only have like 3 or 4 of them. If you guys are interested, then talk to Tyler, and he can set you up with an appointment for that. So it's a free screen, and it's something that I need to kind of remove all the risk, right? So the risk is you come to me and it doesn't work, right? Or I don't know what I'm talking about. So we do the free screen just so that you can, basically we're interviewing you to see if you're appropriate for physical therapy, and you're interviewing us to see if we know what we're talking about. So it doesn't cost you anything. After the free screen, if you're not happy, you can leave. You never have to talk to us again. But most people, after we do the free screen, because our clinicians are so good, they sign up for PT because they want the problem fixed. So if you guys are interested in that, again, I don't have a ton of appointments this week, but this is our busy season. Whoever is interested in, like desperately interested in that, has back pain right now, wants to start fixing that, I would stand up and go talk to Tyler right now. Okay? And anybody else that's kind of sitting here that has more questions, then I'll kind of handle that. So who has more questions about back pain? Yeah? Mm-hmm. Yeah, I saw you when you were walking in. Yep, so were you ever treated for that? Do you have back brace when you were a kid? Any surgeries? Okay. Was this a problem from young age to old age, or more recently? Mm-hmm. Mm-hmm. Yep. Mm-hmm. Yep. So yeah, so we treat patients with scoliosis. We have people that have pretty drastic lordotic and curves that go on. So I would have to see on a screen. Yeah. So, and if you guys want to come see me, you can do that. Like if you think I'm the greatest thing ever, I'm not as good as the other clinicians that I have, right? So I'm focusing on other parts of physical therapy, education, awareness. I'm starting to get more into that. You can come see me. I don't have as many office hours as my other clinicians, and those guys are better than me because that's all they do. And they're doctors, so they have way more education than I do. So more than happy to come see me. It might take a little while to get on my schedule, but I'm telling you, the other clinicians that I have are better than me. Anybody have any other questions? All right, guys, so if you, I'll stick around. If you guys want to ask me questions, then we'll stick around and do that. We got to get rid of some of this food because I can't eat all that food. So if you guys are, oh, I got applause? How about that? You guys are all right.